Hello everyone, I am Dr. Arun Mishra. Today I will talk on a topic migraine headache. Migraine is an episodic, recurring syndrome of unilateral headache associated with some features of neurological dysfunction as nausea and vomiting, and in some to hypersensitization of light and movement. The migraine headache can be of moderate or severe intensity, throbbing or pulsing in nature, and the severity of the headache can be such that it can affect the daily activity of a person. The manifestation of migraine headache is attributed to the dilatation of the extracranial blood vessels and also intracranial extracerebral blood vessels. The genetically susceptible person, they on trigger of the brain by the triggers of inside the body or outside the body, they are responsible for the development of migraine headache. The triggers can be like there is change in estrogen level during menstrual period of ladies and during pregnancy also, which can precipitate a migraine headache. Second is drugs like contraceptive tablets or nitroglycerin, which is a vasodilator and can cause a migraine headache. Third is stress. Ever much stress over the brain, anxiety, tension, or food like aged cheese, chocolate, drinks like alcohol, excess coffee, drinking, or wine, and the sleep disorder. When the person has a disturbed sleep, and there are environmental factors also which are responsible for the initiation of the migraine pain onset. So, migraine headache covers changes in four stages. The first stage is premonitory phase. After trigger of brain reacts and causes neurons in the brain to fire abnormally. In this condition, the patient may have symptoms that he will feel that he is not feeling good and change of mood and activities. The person becomes fatigued, irritable, craving for food and yawning. During this phase, there is an increase in the blood flow of the hypothalamus, which indicates that hypothalamus has a role in this premonitory phase of the person. Second phase is hypersensitivity. These abnormally firing neurons cause hyperexcitability in different regions of the brain and leading to symptoms that affect senses. The person gets nausea, vomiting, and also hypersensitivity to light and sound. In some patients may feel aura. Aura experience either a visual disturbance like some lines in the vision or fortification spectra, photophobia, phonophobia, pins and needles in different parts of the body, the numbness in hands and feet. There can be hemiplegia also, and some persons get visual disturbance or disappearance of vision for some time. The migraine with aura is called classical migraine, and migraine without aura is a common migraine. The third phase is the phase of attack or headache. A migraine headache usually lasts for 4 to 72 hours if untreated. The person may have photophobia, phonophobia, and the pain may be very severe, unilateral, throbbing in intensity, changes in brain stem, and its interaction with trigeminal nerve. This is responsible for the drop in the level of serotonin, a neurotransmitter which is called 5-hydroxytryptamine, and the action of serotonin is, it is a vasoconstrictor, and when there is fall in when there is fall in level of this serotonin in blood circulation, the vasodilatation starts taking. The second thing is the neurotransmitter of the sensory trigeminal pathway, the calcitonin gene-related peptide is released in the blood vessels by the trigeminal nerve, which is responsible for the dilatation and also the neurogenic inflammation of the blood vessel. So, when the blood vessel is dilated and inflammation in the blood vessel takes place, the pain starts. And this is the main reason that the patient receives pain. So, the fourth stage is postdromal stage. In postdromal phase, when the pain subsides in a person, in a migraine, the person may feel drained, washed out, or confused. So, after some time, the patient becomes all right. So, what are the things a patient of migraine should do? Is he should stay himself in a dark room, which helps the person for some extent. Secondly, he should change his habits like alcohol withdrawal, excess coffee should not be taken, and he should change his daily activities, mild exercise to be done, and he should find out the real triggering agent, that on what trigger his migraine pain starts, which is also helpful to the person. Thank you very much. The next part will be covered in the second